Today I'm going to talk to you about brain-computer interface technology. My name is Margaret Gassman. I currently work in neurology, so I picked a topic that has to do extensively with the brain. So today the objectives will be that one will be able to, one, understand the basic definition of brain-computer interface technology, two, give examples of current BCI devices, three, evaluate BCI gaps in the current technology, and four, predict future applications for BCI technology in healthcare. To define brain-computer interface, I tried to find a simple definition as BCI technology is pretty complicated, but researchers at Mayo Clinic defined it as a computer-based system that acquires brain signals, analyzes them, and translates them into commands that are relayed to an output device to carry out a desired action. The primary goal of BCI technology has traditionally been aimed at helping those with neuromuscular disorders such as ALS, cerebral palsy, stroke, or spinal cord injuries. However, over time, it has gone to help other patients, including those with amputations, by providing BCI prosthetics. So the basic design of any BCI system has four parts. The first part is signal acquisition. This is essentially the measurement of brain signals. The most commonly used brain signal or measurement is the EEG, also known as electroencephalograms. The second part, called feature extraction, is the user's intent. This is when the device can take the signals to figure out the user or the patient's intent. The third part is known as the feature translation, which is converting the user's intent into actually commanding the device. And the fourth is applications, also known as device output, which provides the function. Examples of these are neuroprosthetics, spelling devices, and a wheelchair. Current BCI technology used today is difficult to find as most BCI devices are in a controlled research environment and are relatively new. Examples include exoskeletons, which allow those with quadriplegia to walk. And then also there are devices used to control the paralyzed limbs in stroke patients and aid in neurorehabilitation. There are some commercialized BCI devices, including one made in Austria called Intendix. This essentially is a spelling device, but has also been linked to allow the user to play video games and be in an interactive environment. The picture to the right shows an Intendix equipment. Also, as some of you have probably seen on the news or on YouTube, there are also BCI prosthetics, which allow patients and users to use their mind to control their prosthetic. Since BCI technology is so new, there are a lot of needed improvements. Signal acquisition hardware needs a ton of improvement. In non-invasive BCIs, there's a couple ideas that I found for improving the systems. One idea is dry electrodes, so the patient doesn't have to put the gel on their head in order to use the device. Another improvement would be to make the system small and portable so it's easier to use in everyday life or in your house. And then also the 3 C's. The system should be comfortable, it should be convenient, and it should be cosmetically acceptable for the patient so they are comfortable using it around other people in their work life or at doctor's offices. It should also require little maintenance. A lot of these current systems need a lot of maintenance and ongoing technological support. And then there should also be some type of telemetry incorporation instead of extensive wiring. To improve signal acquisition hardware in invasive devices, which invasive devices includes electrode array systems that are surgically put into your brain. Since they're so new, there's a lot of improvement needed. They need to remain intact, functional, and reliable. Since these electrode arrays are so new, we haven't been able to have long-term studies indicating that they can remain functional over time. They also need to incorporate use of telemetry. A lot of these arrays may need an outside device to help the patient use the technology or the application that they're trying to use. We also need to make rechargeable or long-lasting batteries. Similar to a deep brain stimulator, which has both rechargeable and long-lasting batteries, it's important that we make BCI technology have these characteristics as well. Otherwise, patients will constantly need to get a surgical procedure, exposing them to infection and surgical complications. The next big improvement needed is reliability. Overall, BCI technology has been very unreliable, so it's been difficult to have the technology usable to the public. Another major gap in BCI technology is currently there's minimal incentive for commercialization and mass production. This is partly because there is a small number of those who would benefit, which primarily is someone who has a severe neurological condition such as quadriplegia. Another important gap is that we need ongoing technological support for both invasive and non-invasive BCI devices at this time. Furthermore, with any new technology and medication, it can be somewhat difficult to get reimbursement from insurance and government agencies. When looking into the future of how BCI could change our current healthcare system, it's exciting to see that multiple studies have shown that when you combine using a BCI device and showing a patient motor imagery in neurorehabilitation, it may improve motor function after a central nervous system injury. In this diagram is an example of such technology. This patient suffered a stroke. They then put the robotic arm on the paralyzed limb. Then the patient is trained to essentially think about using the limb during neurorehabilitation. And then the robotic system helps move the limb, so they're also seeing it being used as well. What it does is it activates parts of the brain that aren't injured to help move that arm and create new neurological pathways. Some generalized themes of what BCI could improve includes it could greatly affect those with CNS injury and spinal cord injuries by improving their quality of life. They can have increased independence and possibly decrease caregiver burden. And then comparable to telehealth, I could see nurses and nurse practitioners being the leaders in troubleshooting and using the new technology with their patients. So in conclusion, after watching this presentation, I hope that you have gained a basic definition of BCI technology, You can give examples of current devices, such as prosthetics and spelling devices. Evaluate BCI gaps in technology and commercialization of future products, and also predict future applications for BCI technology in healthcare and possibly in your own workplace and patient population.